our patients. So let me start sharing my slides. And I hope you can see my slides.
Yes, sir, we can.
Perfect. These are my disclosure, but actually the real disclosure that I always do when I talk about nutrition is I don't have anything to do with these nuts. They are called after my name, but apparently, one patient when I was in Baltimore brought me a jar of these nuts with my name on it. So I was very curious. So, and they're very good. They're from a volcanic area in the Philippines. Apparently, very nutritious. So I encourage you to try it. You should be able to get it through the web. Anyway, I don't have anything to do with these nuts. So, but what we're gonna do over the next 30 minutes, we need to discuss how nutrition, a healthy diet, may have an impact on patients with kidney cancer. I think there's still a lot of need to be learned and done in this field, not only in kidney cancer, but in cancer in general. But my interest, of course, is particularly in kidney cancer, how healthy diet can have an impact on the treatment outcomes, actually, in patients with kidney cancer. Particularly, we are working in the lab and now starting to look at the effect in patient, how changing the diet. In particular, we're interested in protein restriction to reduce the level of protein in the diet can improve the immune system. And as you know, nowadays the impact of immunotherapies in the kidney cancer patient is very important. But we believe that perhaps nutrition, healthy diet can really help to achieve even better results. So I want to just start with the definition of nutrition. What do we define for nutrition? And it's really, this is one of the many definitions you can find in a dictionary, but it's really a nourishment or energy that is obtained from food consumed or the process of consuming the appropriate amount of nourishment and energy. An example of nutrition is eating a healthy diet. This seems to be a common sense, but unfortunately, I think we are not sensitive to this enough. And why focus on diet and cancer? Again, many of you learned and read that indeed diet can have a major impact on many diseases, including cancer. This is the next slides, just an example how cancer can impact can be impacted by diet and lifestyle. These are the example for prostate cancer, where diet, in particularly a plant-based diet like a vegetable legume consumption, has been associated with lower incidence of prostate cancer, while increase of animal protein has been associated with a more aggressive phenotype in prostate cancer. But I think this notion in prostate cancer that's been relatively well established, I believe it can be applied to other type of cancer, including kidney cancer. And the data throughout the years has shown that if a patient had higher level of protein consumption, may actually have higher chance to die of cancer. And some interesting data, perhaps some of you have been aware that this was done on the Japanese population that eventually migrate to Hawaii, that where in Japan, breast and prostate cancer has a relatively low incidence. When they immigrate to Hawaii, as the first and second generation of Japanese American changed their diet and their lifestyle, likely their incidence was actually closer to the Caucasian Hawaiians. And throughout the years, this is the work of Luigi Fontana, who is a world-renowned expert, used to be a WashU. Here in the States now is leading a major nutritional center in Sydney, Australia. It's been shown throughout the years that indeed the Western diet that can be associated with low protein consumption can affect some important growth factor. This is an example of insulin growth factor. Insulin growth factor is not only associated with insulin and sugar metabolism, but also on tumor growth. Many of the epithelial tumors, including kidney cancer, use this as a gasoline, as a fuel. And it's been shown that the low protein diet actually can lower this potential gasoline for cancer cell. I want to mention again, you're going to have these slides available on the website. So, and then you can dive a little bit more on the data. But this was, and I don't want to be very technical. And again, we're going to have plenty of time for questions later on. But this is, to me, was a very important study, was recently published, showing, I believe, for the first time that indeed dietary change can have a major impact on cancer mortality. This was done primarily in breast cancer, but again, I believe that this can be applicable to other solid tumor, including kidney cancer. And this study where they showed that in women who had diagnosis of breast cancer and follow actually a low-fat diet, had a less chance to die from breast cancer and less chance to die to other causes. And this is, again, was really one of the first evidence that indeed diet intervention, in this case a low-fat diet, can have impact on cancer mortality. Now there are several dietary guidelines available on the website, for example. In many organizations, this is a guidelines from the United States Department of Agriculture. So you can definitely take advantage of these guidelines, what really we mean for nutrition, a healthy diet. But I would say, and again, this is work done by Rachel Bordogna, as a registered dietitian, worked with me at the Indiana University when I was in Indianapolis until a few weeks ago, from Purdue University, and then Bert Kirsch, also a registered dietitian in Indianapolis. But what I want to go through with you is some messages that it's common sense at this point that we need to all have a healthy diet, but how we can achieve that. And I found that this message is very important because it's hard to make changes, drastic change. While in reality, probably and more realistically, I think small changes may help us to achieve our objectives. And it's probably true in many aspects of our life, but especially when we are trying to change our behavior, our lifestyles, including how and what we eat. And I think this is an important message to take. The American Cancer Society also has guidelines that, again, you're going to see these guidelines are kind of overlapping if you look into it, if you read about it. And again, I invite you to look at this in more details, but there are some main messages that all these guidelines tend to share. And one message, for example, is weight, healthy weight throughout life. Again, we know that weight management may be different if a patient has just newly diagnosed of kidney cancer and undergoes surgery and is cancer-free for a while, and maybe this cancer comes back. A different story when, unfortunately, sometimes at the end of the natural history of their disease, they are actually losing weight because they're not eating. But in general, controlling the weight is an important mechanism to have impact on the tumor growth, including kidney cancer. And as you're probably aware, if you are a patient with kidney cancer, that one of the risk factors for kidney cancer is actually obesity. And that tells you, again, going back on the IGF-1, on these hormones that are actually stored in our adipose tissue, tells you that, again, weight management, having a healthy weight is important, perhaps, especially in kidney cancer. Physical activity goes hands to hands with nutrition and healthy diet, as you're already aware. So there is no doubt in my mind that if you decide to follow a healthy diet, you also need to have a physically active lifestyle, meaning do exercise in some shape or form, hopefully every day. Again, we're going to talk about more plant-based eating over the next few slides, but this is also a common guidelines recommendation from also the American Cancer Society. And if you're drinking alcohol, limit consumption is always recommended. You probably been learned and been told about the body mass index. Bottom line is really a way to not only look at the overall weight, but also what is the healthy weight that you are supposed to have based on your height and based on also on your age in some extent. So knowing, I think, your body mass index or BMI, I think it is, to me, an exercise that everybody should do, whether or not, of course, you have a cancer, whether or not you have a kidney cancer, to know what should be your healthy weight. And again, this is one of the charts that you can find, but you can discuss also with your primary care physician that eventually can educate you also what should be your weight. The goal of my talk today and spending time with all of you is really to introduce the role of a cancer dietitian in cancer care. Wherever you go, you might start seeing actually that the dietitian starts participating to your care. I think this is a very important. And again, I will try to give you some reasoning and some rationale why that is important. But this is some of the goals. For example, Beth Kirsch, a registered dietitian that used to work with me at the Indiana University Cancer Center in Indianapolis, put, again, I think the registered dietitian for cancer patient may have a different goals, depends also on the objective that the patient needs to achieve. Of course, if patient is malnourished, meaning that is not eating well, definitely weight gain is important. If a patient does not have malnutrition and is actually weight gain is being a problem, the objective can change. So these are the potential goals that a registered dietitian may have along with each patient with kidney cancer. And I would say primarily a registered dietitian can help you not only perhaps to achieve better outcome in terms of response to treatment and think about the immunotherapy, but also to ameliorate the potential side effect of the therapy you're going through. This is, to me, a fascinating field that we don't really know much about it, but there are some increasing data suggesting, for example, if you have some type of calorie restriction or perhaps a ketogenic diet before you start chemotherapy. Again, we don't use much chemotherapy in kidney cancer, but perhaps there are some treatment. I'm thinking about these anti-angiogenic drugs like maybe cabozantinib or axitinib, where you might have some significant side effect. Perhaps some type of diet intervention and calorie restriction for a short period of time may help you to get through some potential side effect. We talked about the different goals of nutrition during treatment. Again, you might be, as a patient, be through a phase where you're losing weight because of the treatment or because of the cancer. So gaining weight actually is your objective, but there might be other stage of your disease or your treatment where gaining weight is maybe a problem, and you want to actually try to take care of that. Malnutrition, again, is a potential issue that we see in patient care. I think for the kidney cancer, because of the type of treatment we use, in general, this is not very common. As, for example, I'm thinking about patients with throat cancer, where with esophageal cancer, they go through heavy-duty chemotherapy, radiation, some type of surgery, where they're not able to eat. So keeping a nourishment is actually a very important objective. But of course, there are some definition of malnutrition that are available. Again, this is, you can talk about with your primary care physician and your primary oncologist. But this is, for example, we define malnutrition when a patient has a decreased energy over the period of 1 week, a persistent weight loss throughout the weeks, and loss of subcutaneous fat and muscle loss. This is actually can be visualized sometimes with a CAT scan. One concept that probably you heard a lot, and I think it, to me, is very fascinating. We still, again, do not know much about it, how we can take advantage is really inflammation. But inflammation, the way, again, this, again, Beth Kirsch helped me to put these slides together. You can see it as as a disorganized immune response. So when your immune system actually is not focused, that's when inflammation may take over. Inflammation can be the result of many, may have, I would say, different way to manifest. But the bottom line is really, when we talk about inflammation, is a way actually that tumor take advantage of, because it's a way for cancer cells to camouflage to our immune system. And so if we have a high level of inflammation, this disorganized immune system, the immune system is not focused on fighting cancer cells, and that's how the cancer cell may escape. But we now have evidence that indeed one way to control inflammation, beside potential drugs, but is actually eating. So the diet, what we eat, can in some way affect this inflammation. The inflammation is being linked not just in to cancer, but also other disease, including diabetes, heart disease, arthritis, high blood pressure. This is a very simplistic way to see how the diet can affect inflammation. I'm not saying that we have the answer how to in some way control the inflammatory response in our body just with food. But there are some evidence suggesting that perhaps processed food, excess animal protein, particularly red meat and saturated fat, may increase this inflammatory response that drives this, we call it cytokines and chemokines. These are natural products in our body that are secreted and they can, impact or impair our immune system. So I think a common sense is really to try to avoid processed food if we're thinking about try to reduce inflammation in our body and eat more plant-based food. Why plant-based? There are several reasons actually, but some are here again listed in these slides and the next few slides. Is perhaps because the plant-based diet included vitamins, minerals, and fibers that seems to educate our immune system to focus and work more efficiently. These phytochemicals also can be shown to reduce this, we call it oxidative stress on our cells and on our immune cells. Beth put these slides here, and I think I find this actually helpful to visualize how much vegetable and fruits we should eat on a daily basis. I think the more variety of fruit and vegetable we eat, the better it is. The more colorful our plate is, the better it is. But I think 1.5 cups of fruit and 2 or 3 cups of vegetable daily. I think this is a good way to think about the portion of our meals and how much really plant-based eating should be on our table. And again, I'm not trying to say we should all be vegetarian, should be vegan, but of course there is a lot of to say about the plant-based diet, and I know that some of my patients in Indianapolis were following it strictly, and I believe it definitely helped them to go through the side effect and perhaps respond to immunotherapy. So one way to do, of course, to make this shift is to reduce the meat, especially the red meat. And this is a suggestion that Beth has to use the meat more like a garnish, but definitely limit the assumption and use more beans, for example, as a protein source. Because these beans, for example, and seeds and nuts and shoot here are really a good source of minerals, of fibers, not only proteins, but minerals, fibers, and healthy fats that are part of what we call a balanced diet as a base of healthy diet and nutrition. Fish, I think as you know, is pretty much recommended by all the guidelines when you look at good, I would say, animal protein source. And also because, for example, they contain, fish and particularly salmon contain omega-3 fatty acid that we know has a beneficial effect in many biological process, but including also in tumor biology. Using healthy fats in cooking and eating with olive oil, extra virgin. And one slide that I like it here from Beth is really try to think about whole grains and switch to whole grains because this seems to be probably the best, one of the best source of fibers and minerals. So look at one the label on whole wheat rather than other foods where they don't contain this grain, because when we think about even source of carbohydrates, complex carbohydrates are probably fine and better, of course, than simple carbohydrates. And this is an example of oats and quinoa and whole wheat bread. So try to switch from refined grains to whole grain. That's something that whenever we do our shopping, grocery shopping, we should definitely keep in mind. And again, many guidelines at this point do recommend this type of shift. And again, I'm going to mention this over the next few slides, maybe at the end of my talk, but we know that sugar is not good, simple and processed sugar. And so I think that we should definitely minimize that. Now, should we always follow we call a ketogenic diet? So really no carbohydrates or minimal carbohydrates. I'm not sure whether that is the right answer. And perhaps there are some contexts, some stage, some tumor type, including kidney cancer, where a ketogenic diet, so reducing really the carbohydrates, whether they are processed, simple, or complex, is the right things to do. But definitely as a balanced diet, I think avoiding simple and processed sugar is the right things to do, no matter what diet that we want to follow. These are the Harvard plates. I mean, some of you may be familiar with, and again, I give you a nice visual representation what should be our healthy eating, what we should put on our plates. And I think just going through this exercise, to me, I think it's just worth it, especially if our diet is not balanced. Coming from Italy, of course, the Mediterranean diet is something very familiar to me, and I try to implement that on a daily basis. But there is some good into it, because I think, again, as you know, this diet that does put emphasis on fruit and vegetables and fish and seafood rather than meats and sweets. And so, and I think this is something that, again, can help us to visualize more what our objectives are. So my take-home message, and again, on the next few slides at the end of my talk, and I'm going to try to wrap up in a few minutes now, where I'm going to talk more about the research we're doing. But to me, this recommendation, I think, is a common sense at this point. And there are some reasons, perhaps even in kidney cancer, make even more sense than even than other cancer types. But reducing inflammation, especially when a patient are receiving immunotherapy, if this disease is metastatic, or perhaps they're getting immunotherapy now within the clinical trials where they're getting before and after they getting the surgery of the kidney tumor. That's something definitely I think I would recommend. And as a dietary intervention, I think avoid dairy products, milk and cheese, red meat, increase plant-based protein and fibers, increase cruciferous vegetables, and eat more fish. I think this all makes sense. There is a lot of debate about what kind of supplements we should eat, or our cancer patients should eat. And I think there are good argument for many of these supplements. I would say definitely, I would say vitamin D and vitamin C are on top of my list, especially again in patients who are receiving immunotherapy. But at the end, again, as I mentioned early on, that a dietary intervention should always be linked pair with a regular physical activity, because I think this is really the other face of the coin that we need to always keep in mind. I want to go over some data. Again, this is maybe too technical, but I want to tell you why years ago, as a medical oncologist, I get involved in nutrition, because I was not thinking about it, and I met again Luigi Fontana, a colleague, a nutritionist that actually has been working on aging and the effect of protein restriction, especially animal protein restriction in the diet. And we did this simple experiment. These are tumors that we grow in mice, and we measure it. And to me, it was astonishing because by just change the diet, meaning reducing the protein content in the food that will be given to these mice, carrying either human or either prostate or breast cancer, we saw a significant flattening of the curve, a flattening of the tumor growth of this tumor by just changing from 21% to 7% the amount of protein, and actually increasing the level of carbohydrates. And there was actually given chemotherapy or hormonal therapy to these mice. We achieved the same effect by just changing the protein in the diet. That to me was an eye-opening experience, and that's why we started working on, in particular, on protein restriction, and later on we showed that we are able to modulate the microenvironment, all these cells that are in the tumors, and we're able to educate the good immune cells to attack cancer cells by changing the diet, by changing the protein content. And we saw that when we did that, these mice, this is actually a mouse model of kidney cancer. In the purple, you see the mice that actually are given the immunocheckpoint inhibitors. These are the type of drug that patient kidney cancer may receive, like nivolumab or pembrolizumab. In the mice that were receiving low protein in the diet, has much more survival, meaning they were living longer in the context of immunotherapy. That to me was a very, again, eye-opening experience. And this has been confirmed also in another group in France, and with Dr. Fontana, we also published this paper, trying to support the notion that perhaps a low-protein diet may help cancer patient. Again, this is something that we're still in the midst. This is a study we actually initiated in Indianapolis, and we'll try to open also here in Buffalo. This is Rachel Bordonia. That's not her home kitchen. It's actually a metabolic kitchen in the hospital. But what we've been doing in these trials, a patient with prostate cancer were getting vaccine, and Rachel actually was preparing meals for this patient, either with normal protein or low protein, and to see whether actually patient were getting low protein diet had a stronger immune system. We're going to actually replicate this, hopefully in the near future, if we have enough resources to do so, and open a trials for patients with kidney cancer receiving immunotherapy to see that whether for a short period of time, if we reduce the amount of protein in the diet, we might increase the response to immunotherapy. This is actually an important slide, and what it shows is our plan here in Buffalo, but that we would like to expand also to other places where we want to learn about more kidney cancer and how kidney cancer can respond to different protein dietary intervention. Because I believe that not all the kidney cancer are the same. As you know, the clear cells, papillary chromophore, unclassified, and others, translocation. But even within the same tumor type, the metabolism, how these cells consume protein and consume carbohydrates may be different. And so we're trying to set up a platform where we isolate this tumor at the time of the surgery, we give diet to the mice, and that maybe give us some instruction, perhaps what type of diet we might suggest to our patient with kidney cancer. And that's, I think, is the future for cancer therapeutics, how the diet can, we know, have an impact on the microbiota, on the bacteria that we have in the gut. And maybe that is one of the main mechanisms how we can achieve a healthier immune system by changing our diet. But that's definitely, we know, has impact on how, for example, a patient respond to immunotherapy. If they have a healthy gut, healthy bacteria in the gut, perhaps they have a healthy immune system. And how can we achieve that? Perhaps with a healthy diet. And this is something that we're about to open. Again, we have this snack clinic, this science, nutrition, and cancer clinic, snack without decay at the Indiana University. We're going to open this now in Buffalo. And this is an example how we want to monitor our patient with kidney cancer, whether they are getting surgery or they have, unfortunately, advanced disease. But we want to assess the tumor metabolism and also the metabolism in the body, and to see whether or not some diet intervention may have some impact on their well-being. Again, there's a lot that needs to be done, but this is, for us, is a one first step to take. And this is, I think, is one of my last slides. Is really to introduce, to integrate, I would say, a registered dietitian as a personal trainer, as we believe that we should increase our exercise, and of course, having a personal trainer probably would be the ideal situation. But having personal training for the healthy diet, to me, is something that can be achieved by the presence of a registered dietitian, can see patient on a routine basis and set up some goals and try to achieve those goals with healthy diet. This is my dream, to have a place where patients come in and not only to get their infusion, but do exercise, do meditation, and learn how to cook and to have a healthy diet. So these are my last slides. And I believe that there is an unmet need to integrate nutritional support for our kidney cancer patient. I think many places are looking into it, and we're going to try to do our part here in Buffalo and through the Judy Nicholson Kidney Cancer Foundation to expand this also to other locations. But these are our goals, really, to integrate immune-based therapy and diet intervention for our patient with kidney cancer, improve the quality of life, and overall improve the outcome to our patient. And hopefully, like we did in Indianapolis, establish a chapter of the foundation here in Buffalo, New York. So I want to thank you for listening. I think we have several minutes now, the rest of the hours, to be more than glad to answer a question. Again, I want a special thanks to Beth Kirsch and Rachel Bordonia that helped me to put this information together for all of you. Thank you.
Okay. So at this point, we'll open it up to Q&A. Everyone should be able to unmute their microphone if they'd like to ask a question, or you can type it into the chat box and we'll be happy to answer it there. So from Deb Maskins, she's asking, when trying for 7% protein, does that include plant-based proteins like nuts and soy?
That's a good question, Deb. And thank you for dialing in. And so it was interesting. Actually, the experiment we did was just to reduce all the protein in our animal studies from 20% to 7%. So we just decrease all the source of protein. No matter whether it was animal or was plant-based. And we saw this effect on tumor growth, but more importantly, in combination with immunotherapy. However, when we did an experiment where we had only casein is the main protein in the milk as a source of protein, or we had soy as the main source of protein, so it's a plant-based protein, we saw the same effect, suggesting that perhaps a plant-based protein diet can be as effective as low-protein diet. So we can achieve perhaps the same beneficial effect of protein restriction by just switching from animal protein to a more plant-based protein, suggesting that shifting to a vegetarian type of diet, vegan diet, may be beneficial. So I think that's, to me, was a very interesting. Again, I think we need to do more study on that.
And then next question, Mark Manning said that you had mentioned red meat and fish, but where does chicken stand?
In the middle, I guess. A good question. Again, we did some experiment with again in the mice. We cannot get the red meat extract for some reason. It's just not easy, but it's not feasible. But so we have other surrogate. That's why we use a casein as an animal protein. But we did the poultry extract and fish extract in the diet for these mice, and this extract did not work as well as soy, as plant-based protein only, but definitely was better than casein. So we extrapolate that perhaps not all the animal proteins are equal. And that's fascinating to me because I think it depends really on the composition. You know, the proteins, think about the proteins like a building and a house where you build the walls with the bricks. The bricks are the amino acid. The amino acid is actually are the bricks of this house. And you can have a similar house from outside, but the bricks may be different, the size and shape and the material. So I think the different composition of this amino acid may make the difference that we see between plant-based and animal-based, but even within the animal-based. So going to answer, again, I don't have a clear answer about poultry and fish and red meat, but some data would suggest that if you cannot avoid animal protein, definitely I would encourage it. More actually fish than poultry and then meat as less as possible.
Okay, thank you. And Isabella has a question. Do you have recommendations regarding OTC probiotic supplements such as Culturelle?
Yeah, I don't personally. I don't have it. I think it to me is a very interesting concept. Talking about the microbiota and the. I think the field is still under development. Let me put it this way. There are some strong data in kidney cancer patients receiving immunotherapy. This has been studied actually by Gustave Roussy in France, in Paris, showing that if a patient receiving antibiotics even a month before starting nivolumab or pembrolizumab, those patients don't seem to respond as well than patients did not have antibiotics. So that's bring definitely the role of the gut bacteria, the microbiota, the flora in the gut, as an important. There is evidence suggesting that probiotics, some this lactobacillus and others, seems to be more associated with the healthy gut and a healthy immune system. Now, having said that, apparently there's been some study looking at probiotics in cancer patients in general and try to look at the immune system. Those studies prospectively, they don't seem to be very encouraging. So my approach would be, if you want to try probiotics, I think it makes sense if you definitely need to have antibiotics. So try to avoid antibiotics, of course, especially when you are getting immunotherapy. Of course, if you need to have a dental extraction or some other procedure, try to have a short duration antibiotics. And if you need to have antibiotics, I think it makes sense to take some probiotics. But I would not spend money to buy those probiotics that usually are expensive. I would just eat the Greek yogurt. That is a dairy product, but definitely the presence of lactobacillus, I think, outweighed the counter effect of casein. So definitely, I would encourage if you want to have a probiotics, to do it through yogurt assumption. It's a kind of common sense. Again, there is no much scientific base on that.
Do you know is there a known link between tumor growth and the body craving sugar?
I'm not aware about that. Again, in that one of those papers I mentioned, we wrote a review article, and in that article, actually, I state that we have this dogma that sugar, the patient has this dogma that sugar feeds my cancer. This concern. I'm not sure that's true for every type of cancer. Now, we know that kidney cancer is considered actually a metabolic disease, meaning that the tumor metabolism is in some way altered, and perhaps we call it the glycolytic pathway, the glucose consumption in some type of kidney cancer, especially the clear cells, may be elevated. But interesting enough, in our experiment, again, this was replicated also in this group in France. When in their animal studies, they reduced the protein content in the diet to keep the same calorie among the group, and they increased the carbohydrates. They didn't see increased tumor growth, and they still maintain the beneficial effect of protein restriction. Should all patients be on ketogenic diet? I'm not sure that is the answer. I think, there are some groups, think about Louis Cantley, Dr. Cantley at Cornell, where showed very nicely that calorie restriction and a specific tumor type. I think it was colon cancer with specific mutations called PK3CA mutation, with these survival pathways upregulated. Calorie restriction can be through actually ketogenic diet can be beneficial. But I would not necessarily advocate a calorie restriction across every tumor type or every kidney cancer type. It might be true, but maybe in some subtype. And that's why I think it's important to learn about the metabolism of each tumor type beside the genetic signature that this cancer have, really the metabolism, what they're consuming. So again, I think it may be important for some tumor type, but not necessarily for any type of cancer. That's my approach.
And Tony has a question. What is your opinion about intermittent fasting for patients who have been in ED after surgery and with no other chronic illnesses?
That's a very interesting question. We're actually studying both protein restriction and alternating fasting in these animal models. And I believe this dietary intervention, because they're all dietary intervention, even the alternating fasting or calorie restriction, have a different impact on tumor growth and on immune system. In our hands, actually, the synergy that we see with the immunotherapy when we do protein restriction, we don't see it with calorie restriction or alternating fasting. But that's our model, so I don't think this is actually in the kidney cancer model and prostate cancer model, but I don't think that has to be. Now, going back on the question, again, there are different ways to do fasting. I mean, this classical 16 hours fasting, 8 hours eating, I think is a really tolerable, I think, approach for cancer patient and non-cancer patient, I would say. And many cancer patients are actually interested to explore that. I'm not sure whether again, after the disease, I think it's an interesting question to ask. Changing my diet will prevent or will delay, if this cancer is meant to come back, will prevent or delay the time where this cancer is coming back. And I don't have an answer to that. I would say it should not be detrimental, meaning that probably it's not detrimental to do some type of calorie restriction, for example, after surgery. I would be more in favor right now because of the lack of data. To me, I think having balanced diet, shifting more to a plant-based diet with a calorie count that can maintain a normal body mass index. I think these are all objectives that should be discussed with our patient with kidney cancer and then undergo probably maybe surgery. And time will tell us. I think outside the clinical trial, do severe diet intervention, I think it might be a little bit premature. But whatever the person is comfortable with, and if a patient feels great to do some type of calorie restriction, I think that would be reasonable to do that. But I think I would still encourage anybody who wants to do a calorie restriction regimen, for example, ketogenic diet, that really to have a established relation with the registered dietitian and to be part of this, to make the registered dietitian a part of the team with the surgeon and the oncologist.
Thank you. And Paige asks, For someone who's going through immunotherapy treatment, do you still recommend the low protein diet?
I think, again, until we have a really more evidence-based, I'm not sure whether I can propose to do that. We can propose to that, but definitely I would encourage, because low protein diet is, unless you have a registered dietitian working with you, it's hard sometimes to achieve, and I don't think we should propose to do it for a long period of time. I mean, our clinical trial event will explore a protein restriction for a short period of time at the beginning of immunotherapy, when we want to prime the immune system. But what I would definitely suggest for any patient receiving immunotherapy, to try to switch more to a plant-based and vegetarian type of diet. That definitely, I feel comfortable with that.
So Mart and Rachel Roosma have been on the call. They wanted to say hello and that they love you and miss you as past patients of yours. And Rachel wanted to recommend to the people listening today that turmeric and ginger have been really good at reducing Mart's inflammation, and switching to a primarily plant-based diet has helped her husband tremendously with the immunotherapy treatments.
No, thank you, Rachel, and thank you, Matt, to participating today. And I wish you could actually, I know they've been, Martha has been actually one of the keynote speaker in our Ginger Nicholson Kidney Cancer Foundation meeting. So to share his experience, I no doubt in his case, definitely, I strongly believe that his diet is I think it's been vegan actually. I think help him to have the significant response to immunotherapy. And again, this turmeric and ginger definitely are potential. They have a potential benefit on inflammatory response. So that definitely. Now, some people might not like ginger. I don't like ginger, so I cannot eat ginger. But I think. But if you like ginger and turmeric, absolutely, it is a good suggestion.
So Joanne is in the audience, and she's an RCC patient. And like many others, she says that she loses interest or just gets completely queasy thinking about food after treatment. Right. And that many times they're directed to use commercial products like Boost and Ensure for calories, including protein. And she's curious if you had any thoughts on those products.
Well, again, this is something that, especially if she has a difficulty to maintain a healthy diet and maintain actually her weight during treatment, again, to have some type of support by a registered dietitian. I think that's, to me, is very important, because he or she can recommend really maybe a good regimen to not necessarily increase the appetite, but in the way. Supplement, again, I think it's maybe fine. What I would be definitely, most of the protein supplement, most of the time actually contain whey, not casein. Probably it's cheaper and it's easier to make. So we're actually studying the contribution of whey versus casein. They're both in the milk, but casein is 80% of the milk protein and 20% of whey. So, but I'm trying to say that definitely if there is whey in the protein extract, it might be probably better, of course, if as compared to other animal protein. But that's something that we don't know.
It's one of those things that I think they recommend when it's like a last case scenario. If you have no appetite and you're not eating, those things will be better than nothing. But
again, these are going. Yeah, absolutely.
It's always going to be better than the stuff that's out of a can.
I agree with you.
Of course.
I agree with you, Scott. And I think if nourishment and malnutrition is an issue, again, I would definitely encourage to sit down with a dietitian that may hopefully help to identify what is the caloric need of the patient at this stage of the disease and how we can improve. And, again, nutrition, of course, is quality of life, and how we can achieve. And again, if a patient is now eating because, unfortunately, feels sick from the cancer, from the treatment, that's, of course, sometimes very challenging. But again, my recommendation is really try to find, because any cancer center, any clinical practice have access to a dietitian, and so look for it and try to take advantage of their suggestion and advice and help.
And Dahlia, I should say, is asking if there's any benefit to drinking lemon or lime juice in water.
So, but besides probably lime juice is a very good source of vitamin C. I think it's why not? And I'm not sure whether this implicate the fact that try to change the acid in the body. I'm not sure whether that is the question, but of course, hydration is very important, as always, critical in any stage of the disease, and nutrition presupposes actually to have healthy hydration. So water intake is critical.
And Tonita asks if a patient has had gastric sleeve surgery and they need more protein, but they have kidney cancer, what is your recommendation?
Well, again, this is a specific scenario, but I would still, unfortunately, with those type of surgery, absorption is an issue. It's not sometimes only protein, but also fat. So sometimes patient needs to get also enzymes, and so if protein intake has to be optimized, I would still probably favor plant-based. But if you need animal protein, of course, I would encourage you to do more poultry and fish than dairy products and red meat. Again, I'm not saying that patients should forget about red meat if he cannot become vegetarian, but eating once in a while, I think it probably is okay, because if it's true what we think is going on, is really the impact on the diet on the gut microbiota. One meal is not going to change the bacteria in the gut, but eating red meat every day, drinking milk every day will definitely change the bacteria in the gut.
Okay, well, I think that you may have addressed everybody's questions. I want to take 1 minute if there's, oh, you guys can't really see this because it's getting glare. Hold on a second, let me turn on my, you guys see this? No? It's a Cooking with Cancer book, and these are provided for free through the foundation provided by Exelixis. So if anyone is interested in getting a copy of a free cookbook, there's a lot of great stuff in here. I'm probably going to try some out myself. So if anyone wants a free cookbook, then please send just an email requesting one to thejudynicholsonfoundation@gmail.com, and we'll be happy to get one sent out to you. Just provide us with your address and your request, and we'll be happy to get one out to you. So thank you, Exelixis, for providing us with those cookbooks. And Dr. Pili, everyone has been thanking you and saying that your presentation was very informative. Oh, we did have one more question. Says, can you do IV vitamin C while on Yervoy and Opdivo?
But there's a lot of interest in high dose vitamin C. I haven't, I don't have experience with that. I think the group at Hopkins has started doing it. Other places have been doing it. I would be still cautious to do it outside a clinical trial. So I would not recommend necessarily to do it outside the clinical trial. But there is some intriguing data on how vitamin C can improve the immune system. What I would definitely recommend, again, fruit and vegetables has vitamin C and vitamin D, and if your vitamin D level is not within normal limits, I would definitely recommend vitamin D supplementation. But IV vitamin C, I would say right now should be still used only within a clinical trial. Scott, I think you're mute. We cannot hear.
One last question, and then we'll let you go, Dr. Pili.
I'm okay.
Do you have any experience with CBD oil in kidney cancer diets?
Yeah, many patients ask me about CBD and all the permutation of THC and other compounds. I don't know. I have a biased approach, but that's my experience. Years ago, I studied the effect of cannabinoids derivatives on the immune cells and the immune system. And actually, that was done at the University of South Florida. And we saw it actually a suppression of the immune response in vitro and in human cells tested with so I'm not saying that CBD is actually detrimental for the immune system. I cannot say that, but I would not encourage. I don't think there is data suggesting that can help. I would actually be cautioned that it might be detrimental and not helping the immune system. So, having said that, again, this is I think there are other approach that can help patient with kidney cancer. And I think always, if there is any concern, any doubt, any question, I think I would discuss with your primary oncologist.
All right, doctor. Well, thank you so much. It's very informative talk, and anyone who may have missed a piece of this this video can check back tomorrow on our website, and it'll be up there as well as social media. So thank you all for joining us today, and thank you, Dr. Pili.
Oh, thank you. It was a pleasure. Thank you for participating, and thank you again for the Judy Nicholson Kidney Cancer Foundation. I think you are an inspiration to all of us, and we're very pleased to be part of your organization.
Very kind. Thank you
Bye-bye.
all, and have a great day.
Bye-bye.